My name is Amanda Johnson, and this is my patient over 55 H&P. I have Miss SB, a 58-year-old female who came to the ER today by EMS for worsening shortness of breath. She stated that the shortness of breath has started 5 years ago, and that within the last day or so, it has worsened. When EMS got there, she was on room air and 88%. So they gave her 125 of Solumedrol and a Duoneb and brought her to the ER. Once here, I assessed the patient and asked her several questions. She said that she wasn't having any nausea, vomiting, or diarrhea. She wasn't complaining about any chest pain or dizziness or lightheadedness. She was complaining about shortness of breath and cough that has been happening for the last few days and wheeziness. She denies any fevers or chills. While in the ER, we put her on BiPAP to help with her breathing. We gave her some Duonebs, and we started her on Levaquin for the opening of the airways, and we gave her some more steroids. We did get a chest x-ray that showed infiltrates in the lower lobes, which did show that she was having a COPD exacerbation. With review of systems, she reported dyspnea on exertion, shortness of breath, wheezing, cough, congestion. She denied chest pain. She denied any dizziness. She denied nausea, vomiting. She denied muscle weakness or tenderness anywhere. She did have her trachea was midline and supple with no JVD. She didn't show any signs of edema in her upper or lower extremities. She did have 2+ pulses in all of her extremities. Her lungs were diminished bilaterally and anterior lung fields. Mild wheezing, no rales or bronchi. Did endorse dyspnea, cough, shortness of breath. She's negative for accessory muscle use. Her abdomen was soft, non-tender, and all 4 bowel sounds were normal. Her skin was pink and warm and moist. No cyanosis or pallor noted. She was alert and oriented ×4 and very pleasant to talking. She did have a little shortness of breath when she was trying to explain everything to us, and was talking while on the BiPAP. We did do a CBC, which had a slight elevation in their WBCs of 10.9. RBCs were 5.10. Platelets were 200. Her glucose was 114. Bun and creatinine were normal. Sodium was a little low at 127. And her CO2 was 93, with her baseline being in the 50s and 60s. BMP was 58, and pH was 7.52, PCO2 37, PO2 168, bicarb 30, base excess 7.1, and O2 sats were on 100%. We did also do a rapid flu swab, which she did come up negative for. And we did a 12-lead EKG, which came up as normal sinus with no ST elevations. We have a diagnosis of COPD after ruling out pneumonia, flu, CHF, renal failure with having the shortness of breath. It could be fluid could be backing up into her lungs. For her treatment, COPD does happen a lot at Hillcrest, so our normal is putting her on BiPAP, having her stay on that for at least a day, giving her steroids, starting with the Solumedrol and then keeping that for a few more days. They may go home on it, starting the antibiotics and just help as needed. She is not a candidate to be intubated, but we have had previous patients be intubated for this. Thank you.